Hello, my name is Kwekwe. I'm a pharmacist. In today's video, I'm going to be briefly talking about the medication Phentermine, sometimes marketed under the brand name Adipex. We're going to be taking a look at what it is used for, how to take it, some side effects, and some best practices or precautions that you should be aware of if you are taking Phentermine or if you're considering it. So what is Phentermine? Well, the simplest answer to that question is that Phentermine is an appetite suppressant. It is used together with a low-calorie diet and lifestyle modifications, usually for short term to achieve weight loss. Notice that I included diet and lifestyle modifications when I talked about weight loss because Phentermine, like all other weight loss medications, are really not intended to be a one-stop solution to weight loss. Phentermine, and for that matter, all other weight loss medications are only beneficial or useful if they are combined with dietary and lifestyle changes as well. Currently, Phentermine is indicated for short-term use, roughly around 12 weeks, where individuals taking Phentermine are expected to lose about 5% or so of their body weight. Now, the 12 weeks is not a hard and steadfast rule. The duration or how long you stay on the medication will depend on, number one, how well you respond to it, and number two, how even you are tolerating it. For some people, that 12 weeks is enough to kickstart their weight loss journey, that it is enough to go off it and continue on their own. Now, one of the reasons why they recommend short-term is that the longer you stay on the medication like Phentermine, the greater the probability or the risk of you developing what is called tolerance. Tolerance is a situation where you're going to need higher doses of the same medication to achieve the same response. If that scenario happens to you, most likely your doctor will take you off the medication, sometimes maybe briefly, for your body to kind of readjust, and then if he or she thinks is necessary, can put you back on the medication. So how to take Phentermine? Well, Phentermine is available in strengths of 15, 30, 37.5 milligrams tablets, capsules, and orally disintegrating tablets. Our best practice is to be taking in the morning as far away from bedtime as possible, and I'll touch on that shortly. It is also available as 8 milligram tablets, marketed under the brand name Lomaira, where it is taken 3 times a day before meals. Phentermine is also available in combination with topiramate to form a medication called leucemia, which I'm going to have a video on it, and I'm going to link into the description as well. Let's talk about some potential side effects, and the first on my list is insomnia. Trouble falling asleep or staying asleep is a relatively common side effect of Phentermine. If stimulants cause you to, kind of feel very alert, gives you energy, and therefore it makes going to bed difficult if you take it too close to bedtime. So best practice is to take it in the morning or as far away from your bedtime as possible, so that by the time you're ready to go to sleep, the effects will have worn off and you can have a good night's sleep. And also maintain all other best practices for sleeping. Avoid, caffeine, avoid a heavy meal before bed, avoid alcohol, those things that will ordinarily cause insomnia. You want to eliminate it while you take Phentermine, just so you can have a good night's sleep. Second side effect on my list here is dry mouth. Phentermine has the potential to cause dry mouth because it causes a decrease in saliva production, and therefore that is something to be worried about. Chronic dry mouth can lead to tooth decay and difficulty swallowing. So discuss this with your doctor. Keep hydrated for the most part. If that doesn't solve the problem, you can consider some of this over-the-counter artificial salivas or gums that are over-the-counter. Just be careful with some of these preparations, as sometimes the sweetness that they use can cause bloating in some people. So just FYI. Number 3 is headache. Phentermine has been known to cause headache in some people. This is because it affects the blood vessels. It can relax and constrict the blood vessels, sending pain signals to the brain. So this is also another relatively common side effect. One of the ways to mitigate that is to keep hydrated. Of course, if the headache persists, discuss with your doctor to see if there are any other actions that you should be taking. Another potential side effect is tremors. Some people experience tremors or shakiness when they take Phentermine. While this is very mild and usually will go away after just a couple of days of taking the Phentermine, if it persists, it may be indicative of the fact that maybe your dose is too high. So that is not one that you should just sweep under the carpet. If it continues, you really need to be talking to your doctor about. The next potential side effect is gastrointestinal or stomach issues. Phentermine, interestingly, can cause either constipation or diarrhea in people, depending on how your body responds to it. But in either case, be it diarrhea or constipation, keeping well hydrated or drinking lots of fluids is recommended. This is because if it's constipation, drinking enough fluids or water will kind of help, the bowel movement, make the bowel movement easier. And in terms of diarrhea, it will replenish all the fluids that you're losing so that you don't become dehydrated. The next side effect is the potential for increased blood pressure or increased heart rate. As I mentioned earlier, Phentermine is a stimulant, so it has the ability to to kind of increase your heart rate, or it can also cause constriction of the blood vessels, all of them leading to a potential increase in your blood pressure. So monitoring your blood pressure while you're taking phentermine, especially when you started, is definitely a good idea. If you have somebody with uncontrolled blood pressure, you may not be a good candidate for phentermine. So discuss all those parameters with your doctor before you even start on phentermine. Now let's switch our attention to some precautions or some best practices that you should be aware of if you're taking phentermine or if you're considering it. The first one is potential drug interactions with medications that increase serotonin. So I can think of SSRIs or antidepressants, selective serotonin reuptake inhibitors. They include Zoloft or sertraline, Paxil, paroxetine, or Prozac or fluoxetine, that family of medications. The deal with that is that phentermine has been shown in some instances to increase serotonin levels of some individuals. So when you're combining it with another medication that is also increasing your serotonin levels, there is a potential that you may get too much. And serotonin syndrome, which is quite rare, but if it happens, it can be dangerous. It would involve an increased heart rate, increased blood pressure, sometimes could be fatal. So just let your doctor or your pharmacist know all the medications that you're taking if you decide to go on phentermine. The next precaution that you should be aware of is that phentermine can be habit forming, and therefore there is a potential for misuse or drug abuse. For that reason, here in the United States, phentermine is a controlled substance. Its structure is similar to that of the amphetamines, and if you're familiar with the amphetamines, you know the amphetamines have a potential for abuse. In practice, however, the ability of phentermine to cause dependence or to cause that effect, the amphetamine effect, is relatively mild, and therefore it is usually not of concern for people who are taking phentermine at the prescribed doses over the duration that they're supposed to be taking it. Most people are able to take it without issues, but it's just something to have at the back of your mind. If you already have a history of drug misuse or drug abuse, then you may want to be taking a little bit closer look at phentermine or discussing it more in detail before you start on it to begin with. The next precaution is people with a history of heart disease. As mentioned, phentermine can increase your blood pressure and can also increase your heart rate. So if you already have a history of heart disease, you may not necessarily be a good candidate for phentermine. Discuss that into detail more with your doctor. So if you have a history of stroke, heart failure, or heart rhythm issues, you may not be a good candidate for phentermine. Similarly, people with a history of uncontrolled hypertension or high blood pressure may not be good candidates for phentermine. You make sure you're discussing this with your doctor. Maybe there may be some medication adjustments of your high blood pressure medications if, as of necessity, you need to stay on phentermine. But generally speaking, if you have uncontrolled high blood pressure, you may not be a good candidate to take phentermine. Another precaution that needs to be taken into account is hyperthyroidism, where it's hyper when you have too much thyroid hormones being produced by your thyroid gland. For such people, you need to be careful because phentermine on its own can also increase thyroid hormone activity. So when you're combining with a pre-existing situation like that, their combination is not necessarily recommended. It may cause you to experience more severe side effects of your hyperthyroidism. So that's just something to be aware of and discuss with your doctor. And the next precaution is people who have glaucoma, people who have increased eye pressure. Phentermine can aggravate that condition. So make sure you are mentioning that to your doctor before you start phentermine. So high level overview of phentermine. I hope you found some value in it. If you did, give it a thumbs up. On your screen now is a playlist that I did on other weight loss medications. Hope you enjoyed that as well. Thank you very much. Catch you on the next video. Stay blessed.